Hello everyone. My name is Jenny Hart and today I'd like to share with you some information about attachment and foster care. Let's start by looking at foster care. Unfortunately, when a child is at risk for harm through abuse, neglect, or insufficient care, they may be removed from their biological home and placed in foster care. A foster caregiver will provide a temporary home that's a safe place for these children. So when we look at some facts about foster care, we'll see that there are possibly over 400,000 children in the United States alone that are living in foster care. Within that number, there's a variety of placements. This may include a child living with a relative, called kinship care, with a non-relative, so essentially a stranger, in a pre-adoption home, in a group home, or in rare cases in an institution. Now, of course, the goal is that the child is in the foster care system for the least amount of time possible. However, there's a lot of variety in the length of stay in a foster care home. This could be between less than 1 month to greater than 5 years. Now, we've talked about the placement and we've talked about the length of stay, but there's another variable here, and that's the goal for the child in foster care. So what happens when the child leaves the foster care system? For many children, the goal is to be reunited with their families, their biological parents, and placed back in their home. However, other children may go on to be adopted, to live with another relative, or if they're an adolescent, they may be emancipated and live independently. Now I want to share some information about attachment. So attachment is the idea that there's an important relationship that forms between a baby and the mother or the primary caregiver. So I've listed 3 types of attachments here. The first is a secure attachment. And in a secure relationship, the mother is usually someone that attends to the child and interacts with the child in a positive way. It's believed that the children in a secure attachment are ones that may show less difficult behaviors. We've also got something called an insecure avoidant attachment. And in this kind of relationship, the mother may not tend to the child's needs and may not respond to the child when the child cries and may in fact ignore the child. So the thought here is that these kinds of children in insecure avoidant attachments may withdraw from others or may appear that they don't need help from others. And then finally, we've got something called the disorganized attachment. And in this kind of relationship, the mother may be unpredictable and show a variety of emotions such as anger and fear and may even show aggression. And it's believed that these kind of children in disorganized attachments may also show unpredictable and challenging behaviors. So what does this mean for those involved in the foster care system? What does attachment mean for those in foster care? In foster care, we're talking about children that have been removed from their home because they have been at risk for harm. This might lead us to believe that these children may not have had a secure attachment with their biological caregiver. So then we have children with insecure or disorganized attachment that are placed in a foster care home, and these children may show some behaviors which are confusing to their caregivers. They may withdraw. They may act like they don't need help from an adult or they don't need nurturing or care, even though they may be very young children. So in addition to thinking of the children, we also need to think about the caregivers. These are people who have opened up their homes and are asked to give a loving, caring environment to children, knowing that the situation is temporary and the child will leave the home once the placement is done. So we can probably understand that some caregivers may be reluctant to form an attachment with these children when they know that children are not there for long and may be there for a limited amount of time. So unfortunately, if the caregiver does not form a relationship with the child or cannot manage these confusing behaviors, the caregiver may ask the child to go to a different foster care home, and the child may end up in multiple homes during their time in foster care. This is very detrimental to the child and could lead to additional attachment disorders or additional problems for the child. So why is it important to provide these opportunities for secure attachment? As I mentioned, children who are in foster care have been removed because they've been in traumatic or stressful situations. So there's something called cortisol, which is a stress hormone, and children who have had these traumatic or stressful events happen to them may have uneven or elevated levels of cortisol. However, there's some research out there that shows that children with more secure attachments may have a more steady level of that stress hormone and may show the levels that are more seen in the typical family dynamic. This makes children better suited to manage their own emotions and behavior. So this more even level of cortisol can help children manage their behavior and emotions. So in addition to that, when there's a secure attachment, children are less likely to bottle up their emotions and hold them inside them. That means they're less likely to develop these internalized mental health disorders such as depression and anxiety. So the question is, how can we support attachment within the foster care system? Well, the first thing we can do is to advocate for more specialized training for foster care families. Before a child is placed in a home, the family does need to go through some form of training. However, it does not always consider the child's needs. One type of training that supports attachment is maternal sensitivity training, and I've outlined here a specific kind of training called attachment and biobehavioral catch-up. And this is a evidence-based intervention which provides caregivers training in nurturing the child and in letting the child be the leader and delight in the things that the child delights in, and also how to be a sensitive caregiver. Now, in addition to our foster caregivers, we can't forget our biological families, our biological parents, because again, in many of these cases, the goal for the child is to be reunited with the biological family. This means we've got different interventions which may be better for the biological families. And I've included some here, such as home visitation programs and video feedback programs. However, they don't really have evidence to support that they're making a positive change for these families. So you can see how challenging it is for us to support secure attachment in foster care. We've got children and families that have very specialized needs in the area of attachment. And we've got a lot of variables here, such as the type of placement, the length of placement, the past experiences, and even the goals of the child that's in foster care. However, when we're supporting these quality attachments, we're not only supporting the children in foster care, but we're also supporting the foster caregivers, because once the caregivers can begin to understand these behaviors, these signs that the children are giving them, they will be able to better interpret this for future children in their care. We see that there's a lot of understanding now happening about the importance of attachment in foster care, but there's also need for more research. Because the goal really should be for us to develop the most suitable and the most individualized interventions. That may mean looking at these children on a case-by-case basis and taking in all these variables into account. Thank you very much for listening to my presentation on attachment and foster care. I've got some references here if you'd like any additional information, and thank you very much.